So when we think about the voice of the child, there are so many different elements to consider. And the physical voice, the voice that we hear, is just the tip of the iceberg. As practitioners, we work with children who communicate with us verbally and non-verbally, and we have to make sure that we gain an understanding from their perspective.
So children communicate in a variety of ways. From birth, children are using non-verbal communication through eye contact, smiling, crying, laughing, all those small subtle cues that parents are able to pick up on. A child's voice is their way of expressing their feelings, their thoughts, their emotions, and they need that voice to be able to express their likes, dislikes, sensory preferences, and their goals.
So the voice of the child can also be an absence of something as well as a presence of something. So if children and young people aren't showing up, presenting, engaging with us, attending school, attending activities, attending events in the way that we expect them to or in the way that they normally would, that's also a way of them communicating with us and telling us for whatever reason that they don't want to or don't feel like they can be there.
So we know that working with children can offer various different responses across various age ranges, but specifically thinking about infants and thinking about their voice. So infants will show their voices in many different ways, in a variety of different ways, and they do this through the noises, the movements, the responses during interactions that they may have with caregivers. We're thinking about perhaps vocalisations. What is the baby trying to say to us? How is the baby trying to communicate? We know that babies will absolutely be crying, and we know that's everyday part of normal communication for babies. And we're thinking about this baby's ability to vocalise to us or lack of ability to vocalise. So it's really important to note that a silent baby isn't always a happy baby, and we absolutely do want our infants to turn to us at times, especially in times of distress. It tells us very clearly that they need something for us. So an infant that is always silent or passive is something to be really curious about.
Young people might express their thoughts and feelings to others, well, I would say kind of through three ways. The first being unknowingly. So they're not really aware how these thoughts and feelings are bothering them, so they're kind of subconsciously expressing them to other people. Maybe like they look more tired, or they've had a personality change, or something kind of subtle like that that you wouldn't really pick up on. And then I would also say they're subtly hinting it to people, maybe through an action or a message online, but not going to the person and telling them like this is what's happening, like these are my thoughts and feelings, just kind of subtly hinting it towards people rather than having to have a confrontational chat with somebody. And then lastly, I would say when they directly confront those feelings because they don't want to feel like that or have those thoughts anymore, so they go to an adult or a trusted friend and then tell them directly like this is my thoughts and feelings and I don't want to have these anymore or I need help.
The voice of the child is about a lot more than just hearing what children say and asking them what they think. Because we need to remember that not all children can communicate verbally, and children with special needs and additional needs might need to communicate through pictures or sign or some other communication. But essentially the voice of the child is about understanding what the experience of being that child is like for that child.